Bismillahirrahmanirrahim. I am Dr. Javed Iqbal Khokar, Professor of Forensic Medicine and Toxicology. As I am discussing personal identity, and this is the 23rd lecture of this series, and as I am discussing the parameters of age and with the help of teeth, examination of teeth. So, in this lecture, I will be discussing Gustafson method of age estimation. And the contents of the talk will be that I'll be discussing how the Gustafson method help in age estimation and what changes appear in the teeth with advancing age. What is Gustafson method? Gustafson method for age determination from tooth is based on evaluation of ground section of teeth, and 6 age associated parameters are evaluated in the ground section, and they are compared to a regression curve of age versus the age associated changes. So these are basically age related degenerative changes which help in estimation of age. And in this method of age estimation, the microscopic examination of longitudinal section of the central part of tooth is done, and it assesses changes in the teeth as a result of wear and tear with advancing age. And these changes are graded into 6 types. The first stage is the degree of attrition or gradual wearing out of the teeth. Then the second stage is the periodontosis or loosening of the teeth. Then the third is the secondary dentition formation or infilling of the normal root cavity. And the fourth is cementum apposition or increasing the tissue holding the root in place. Then there is root absorption and root transparency. These are 6 stages which advances with advancement in the age, and from these changes we find out the age. It helps to estimate the age between 25th year to 60th year. And of the 6 criteria which we use, the root transparency is the most reliable one. So the criteria of root transparency is most reliable, and root resorption is least dependent. That is least important, root resorption. The most important is root transparency. So this is the picture I told you I am going to discuss. They are marked as T1, T2 and T3. Basically this diagram is showing the root transparency. You can see at the lower T1 scoring, that is noticeable root transparency. Just you can see root becoming transparent. There are no lines. So tip is noticeable, showing transparency. Then T2, that is root transparency extend over the apical third of the root. And then T3, the root transparency extends over the apical 2/3 of the root. So that's how they determine the age. This is the root transparency which is most reliable indicator. And in this, it is showing all the changes. A for attrition, S for secondary dentine deposition, P for periodontosis, and C for cementum apposition, and R root reabsorption. So you can see the leftmost picture showing A0, no attrition, S, no secondary dentine, and P0, no periodontosis. similarly C0, no cementum apposition, R0, no root absorption. And in the second, where the root is orifice is closed, A1, addition within the enamel. You can see the top A1, the addition within enamel. S2, secondary dentine has begun to form in the upper part of the pulp cavity. P1, periodontosis just begun. And C1, apposition a little greater than normal. And R1, root absorption only small isolated spot. Then in the third picture you can see A2, addition reaching the dentine, and S2 pulp cavity is half filled with secondary dentine deposition. And P2, the periodontosis along the first 1/3 of the root, and C2, the greater layer of cementum, and R2, greater loss of substrate, that's a root reabsorption. And in the rightmost, the fourth diagram, A3, the addition reaching the pulp, and S3, pulp cavity is nearly or wholly filled with secondary dentine. And P1, periodontosis has passed 2/3 of the root, and C1, heavy layer of cementum, and C3 was the above heavy layer of cementum, and R3, greater areas of both cementum and dentine affected, that is root reabsorption. So this is the detailed diagram. It's a very detailed topic, just having the information that how they determine the age is determined from the degenerative cases. Take care. Allah Hafiz. So thank you very much. Take care and Allah.